You are now listening to the Be Your Own #LoveGoals podcast with Mo Ari
and Tiffany.
We just want you to remember that every person, regardless of identity, wants these three things: belonging, authenticity, and love.
And after a decade of partnership, we've learned to co-create these things and so much more.
So from wherever you're listening, we're going to go on a journey of becoming our own #LoveGoals. Now let's get into this episode. Hey, it's Mo Ari.
And Tiffany.
And this is the Be Your Own Love Goals podcast. Thank you so much for joining us.
Yay.
We have an amazing guest here today. Her name is Dr. Jen Litner. She is a licensed marriage and family therapist. She is also a colleague and friend. So a little bit about Jen. Dr. Jennifer Litner is a sexologist and the founder of Embrace Sexual Wellness in Chicago. She has over a decade of experience working, studying, and teaching in the field of sexual health with a specialization in sex therapy, sexuality education, and helping people thrive in their intimate relationships. We are so excited to have Dr. Jen with us, and we are just going to get into this episode. All right, we are here with Jen, and I am super excited to talk to Jen. Everybody, you probably don't know, but I tell everybody I went to grad school with Jen, and she's like amazing. We are super happy to have her here. She's not only a colleague, she's also a friend, and she is brilliant. And so she's going to be educating us on so many things. Her area of expertise is actually sex therapy. And I consider myself a relationship therapist, but I would say this is above my pay grade. I really have not specialized in this area. So it's really great to have her. Thanks for being here, Jen.
Thank you, Jen.
Thank you so much for having me. I'm excited to dive in.
Yay. Yes. So starting out, we always ask everyone to give us what we say is the moral of the story. So for you as an expert, we just want you to give our audience up front what you've learned from your years of experience as a therapist. It's pretty much been, what would you say, like a decade at this point of like doing therapy ongoing since grad school. So what would you say you've learned?
I feel like within the sex therapy community, a lot of people who are not in my field, when they hear what I do, are pretty shocked, or they think, oh, it's such a salacious kind of thing that I'm doing. Yeah. And it's like, oh, you must be hearing all these spicy stories. And to be honest, I feel like the thing that I've learned is just how much like sadness and hurt is really wrapped into the vulnerability that we feel when it comes to sex and when it comes to sex in intimate relationships. And it's so interesting when people say that to me, because my response is like, it's really not what you think, right? Like it's not that this is this super spicy, sexy experience that, you know, a lot of people are coming in with pain and hurt and wounds and things that they're trying to repair. And it's a very different place that I'm sitting in than pleasure enhancement, which is also can be part of people's work. So I think one of the things I've learned is just having humility for meeting people wherever they are at on their journey and when it comes to sexuality, because it's such an evolving place for so many of us, and we're all, you know, we can all be in different places and still be normal. And I think that's a big thing that gets taken apart in media and talked about a lot, of like what's normal when it comes to sex.
Wow. Yeah.
Wow. Thank you for sharing that, Jen. I think the vulnerability piece just really struck a chord with me, because in my own journey of discovering my sexuality outside of being in a relationship, but also being in a relationship, I've realized how much of it is being vulnerable, being willing to talk about things, being willing to confront things, pains, traumas, all of these different things that you're talking about. And so I love that you are talking about that as a thing that you really learned in your work as a sex therapist, because I speak to so many friends. Like I said, my own experience and vulnerability honestly feels like the through line for some of the challenge and difficulty for people as it relates to sex, intimacy, sexuality in general. So thank you so much for sharing that.
Yeah.
Yeah, of course.
Yeah.
Mm. I'm just really sitting in that
I
piece
feel
of
a
it.
question coming from you, so I'm just holding a lot of space.
So, Jen,
Yeah.
like you were saying, I feel like for a lot of people, they don't understand what sex therapy is, right? So they don't,
Hmm.
I feel like because of media and culture, we have these ideas or even stigmas around sex therapy. And
Hmm.
so as in your work, do you work with both individuals and people in relationships? And then could you talk a little bit
Hmm.
about how that work is different? Because I realize how much of who we are as sexual beings
Mm.
is goes beyond us being married or in a relationship. It's like our
Yeah.
connection to ourselves sexually. So
Yeah.
could you
Hmm.
speak a little bit to how that what's the what's the difference between that work or if there's a difference?
Yeah.
Hmm. Yeah, for sure. So, um, most of the time, sex therapy can take place with either modality, individuals or relationships. So, whether that's, a dyad or greater,
Mhm.
most sex therapists work with both. And it really comes down to what is your training and supporting couples therapy and
Mm.
or relationship therapy. If you are somebody who really doesn't have any training around that, you either kind of go the route of getting some and then, being able to support folks in relationships, or you kind of work on the individual side. So I do both in my practice. I think that's just speaks to kind of our training, Mo.
Yeah.
And in terms of how the work can differ, it's,
Mhm.
it largely depends on what it is that the person is coming in with. And
Mhm.
so also, are they partnered, right? So let's say somebody is coming in and they're having challenges experiencing orgasm, and maybe they
Mhm.
are finding
Mm.
themselves feeling really anxious or
Mhm.
distracted. Then that might be something they come in with individually because there are some internal barriers that are getting in the way, that would
Mm.
Mm.
be more suited to have that conversation individually. Whereas there are some times where there's a relationship reason that some of the sexual symptoms are occurring, such as, a couple is having a lot of arguments and there's a lot of tension, or they're
Mm.
going through really difficult life transitions. And
Mhm.
that's really impacting the desire they feel or lack thereof towards one another around sex. So
Yeah.
that would
Mm.
be better suited to be treated in a relational setting. So it really depends on what the issue is, how it's playing out. Also, is this person partnered? Is the partner willing to engage in the therapy? But we
Mm.
do know that when something's affecting the relationship, it's always better for the partner to be involved from an outcome standpoint.
Mhm.
Mm. Mm.
Mm.
Yeah.
Mm.
Yeah,
Yeah.
what you said, well, what each of you all have been getting at about
Mhm.
this work taking on many different modalities so
Mhm.
that individuals can be very much invested in sex therapy, I think is not common knowledge. So I was very
No.
struck by that.
Yeah.
And at what point do you think maybe it's not at what point, I'm hearing that it's often dyads or greater that come to sex therapy, but
Mhm.
when would an individual show up to
Mm.
you and say, "Hey, I really think I should be in sex therapy. I want to work with you."
Hmm. So there are a lot of different things that that can present, but a couple of them that I think about are going to be like sexual pain or pelvic pain. If somebody's
Mm,
experiencing pain,
Mm.
they might be
yeah,
experiencing fear. They might be
yeah,
experiencing distraction, anxiety related to sex. And those are things
mhm,
that, while they might be in a partnered context or maybe dating, these are some things that they could work on around treating some of the anxiety
Mhm.
and the symptoms they're experiencing related to that.
Mm.
We also work very closely, at least in our practice, we work integratively with other healthcare providers. So if somebody
okay,
is seeing a pelvic floor physical therapist, or they're working with a
Okay.
urologist or OB-GYN, we're working with
mhm,
those providers, getting
Mm.
a release, talking to them, making sure we're all on the same page in terms of treatment.
Mm.
Because
okay,
when the whole treatment team works together, it generally is a better outcome for the patient or the client.
Mm.
So yeah,
yeah,
going back to your original question, if something is more, like it requires sort of that individual attention, then I think like,
yeah,
pain, trauma, any kind of like internal, narratives that are not supporting sex, like those are good things to be working on individually. And sometimes
Yeah.
it's appropriate for an individual to be in individual therapy, but they also have a couples therapist and they're working on communication
Okay.
Mm.
in that relationship or couples therapy. So I think that there's a way, it really depends on, again, what a person's
Yeah.
coming in with,
Mhm.
and also how significant are these concerns for this individual and how is that impacting the relationship dynamic. I've
Yeah.
also worked with folks who have a fear of dating or have dating related anxiety
Mm.
because of performance anxiety or sexual pain or things
Yeah.
like that. It's
Mm.
incredibly
Mhm.
common. We carry, Tiff, like you mentioned, like all the vulnerability, right? Like
Mhm.
Mhm.
there's
Mhm.
all of that comes up when we put ourselves out there to build a new relationship. So I could
Mhm.
go on, but I think that maybe gives you a little context there.
Yeah, that's
Mm.
very
That's
helpful.
helpful.
I do have a follow-up question. Now, this is going beyond like the
Please, yeah.
realm of like, well, it's related to sex therapy, but going outside of like just the therapy context or the therapy container.
Mm-hmm.
When we think about like what it means, okay, when we think about what it means, let's say in a cisgender heterosexual context to be sex positive. I know that this gets
Mm-hmm.
talked about a lot,
Mhm.
but I'm
Mm-hmm.
certain it means different things in a cisgender hetero relationship. It means different things between men and women. What it looks like to be sex positive, especially throw in any kind of like
Mm-hmm.
traditional or conservative values around
Mm.
that. Um,
Mm-hmm.
when you think about sex positivity, what do you encourage your clients toward when it comes to that? Like, what does that mean in the context of
Mm-hmm.
um, building a relationship that is like open to one another's desires? What
Mm-hmm.
is sex positivity?
Mm.
Mm-hmm. To me, when I think about a sex positive relationship, and that could be with oneself, with sex, with one another, I think about a relationship that's free of coercion, a relationship
Yeah,
where there is ongoing consent, it's collaborative. People can talk about what they want and what they're interested in, and that there's no pressure or shaming happening.
yeah,
Doesn't what it doesn't mean is that you absolutely love sex all the time and you want to have sex all
yeah,
the
Mhm.
time. I think the word positive kind of inflate. It's like somebody presses the inflate button on this like sex balloon. That's not what this means. What it
Yeah.
means is that everyone deserves to have a positive relationship with sex, and everything
Mhm.
mm,
that could get in the way of that is worked upon.
mhm,
So that's kind of how I
Mm.
think about it. Is like
Mhm.
there's a healthy, there's no barriers that are really kind of getting in the way of somebody being able to access, sex in the way that they would want to. We're working on, sex positive movement also focuses a lot on pleasure, curiosity, things like
yeah.
that. So,
Mm.
yeah, those are some of the things that I think about when I think about the sex positive movement.
I
Mm.
appreciate you saying that it's not just like you want sex all the time. And I know somebody listening was like,
Yeah.
okay, good. Like
Yeah.
that's one that I
Like,
think
I'm
has
sign
many
me up.
misconceptions. Yeah. Exactly.
Oh my God. Yeah, that I definitely can see how a person could just assume that being sex positive is just like, oh my gosh, I love sex so much. But I love that you're talking about this
Mhm.
level of openness and curiosity,
Yeah.
even to just
Mhm.
explore and have
Mhm.
conversations. Now, the exploration might not lead
Mhm.
to always doing all of these things that you're proposing, but just going there in your mind
Yeah.
and having these conversations. I admittedly am not a
Yeah.
person who does very well with hypotheticals, but I do
Mm.
find the benefit and the beauty in being able to explore and think about like, oh, what would this be like? Or oh, like I could see this potentially being a really great experience.
Yeah.
Yeah. Yeah,
Yeah.
I think it's so important to clarify too, like language, because I think a lot of people, just like sex therapy, they think like, oh, like is that therapy where you're having sex? Like, it's like people put two words together and they like don't really understand what that means, right?
Yeah.
And same with sex positive. It's like, oh, like I have to
Yeah.
be super positive about sex all the time, and that's not really what that means. Um,
Yeah.
but it's helpful to, I think, clarify that and
Mhm.
whatnot. So I appreciate you bringing that to the
Yeah.
center here.
Yeah, I'm gonna push on you some more because I've got all the questions, and
Keep
I
going.
will
Keep it going.
I will rely on the strength of our connection. Because there, I think what's come up a lot over time as like marriage has
Mm-hmm.
evolved, relationships have evolved, there
Mm-hmm.
have boundaries have expanded around what monogamy even means. So I'd say we're
Mm-hmm.
monogamish,
Mhm.
which is really like a
Mm-hmm.
polyamorous leaning for our relationship,
Mhm.
because we knew from the beginning we
Mm-hmm.
really wanted like openness to explore
Mhm.
sexuality in a
Mm-hmm.
I just always wanted Tiffany to be able to tell me this is what I like, this is, you know, who I like,
Mhm.
because we know attraction just continues to evolve over a relationship.
Mhm.
So I've got
Mm-hmm.
multiple questions. The baseline of the question, though, started with thinking about how porn has evolved in our society,
Mhm.
and well, I
Mm-hmm.
should say, conversations around porn have evolved, and some have not evolved.
Mhm.
I'm really wondering
Mm-hmm.
if there is a general stance that sex therapists have toward pornography, or does that really vary across the profession? And if you have any insights on how couples can navigate
That's a good
talking
question.
about porn, or even, I
Mm-hmm.
won't even go into integrating into their relationship. I think many people are at, is it a bad thing? Is it a good thing? And what do sex
Mm-hmm.
therapists caution people to look out for or encourage them to do
Mm-hmm.
when even exploring that in their relationship?
Mm.
Mm-hmm. Yeah, I can absolutely answer that. I have
Yeah.
one follow-up question, which is how would you define porn in this context?
Oh, that's a good question.
Yeah,
Huh.
that's good.
So I was just thinking the basics of going online to Pornhub. I hadn't gone
Okay,
that
all right, like
further.
mainstream videos, like on Pornhub,
Yeah.
that kind of
Yeah,
thing. Okay,
yeah.
okay, cool. That
Oh my
works.
god, you're right. There is so
So
much of there's such a large internet out there.
it's such a large internet, and I think that one of the things that I don't want to speak for all sex therapists. I feel like that's like a huge group of like 5,000 people in the U.S. potentially, if not
Yeah,
more. But the thing that I'm thinking about are just like how we often are trained to ask, like, well, what do you mean by this, right? Like, what is your definition of porn? Because I think that varies from person to person too. Just like, what does having sex look like for, a set of people
yeah,
or crew of people. So,
Mhm.
yeah. So in terms of like sex therapist stance on porn, I think generally, it varies. There's two things. One, it varies by provider, but I think in general, we tend to be, I'll speak for myself in my practice. And I think this is how most of my colleagues feel, is that we're not necessarily anti-porn, but we
yeah,
are very much pro like being aware of the consumption of porn, how that
yeah,
impacts you, how it's created.
Mhm.
So using more of a media literacy perspective, which is something we
Mhm.
center a
yeah,
lot in sex education and
Mhm.
yeah,
something that we teach about to young people as well, when we, not necessarily pertaining to porn, but even just like anything we read about, right? We want to know,
yeah,
where did who's creating this, right? What are their
yeah,
intentions? How is this
Mhm.
landing for you? How is it intended to
mm,
land? Um,
mhm,
all of that. And so, yeah, I would say like we tend to not be necessarily anti-porn per se, but
yeah,
we do recognize the impact it can have on people from an
Right.
yeah,
education perspective and
Mhm.
also a health perspective. So those are things that come up. There are some providers who I think maybe feel differently than me. So I, again, don't want to speak for everybody.
Yeah.
yeah,
And your second question was about relationships. What can couples or partners do?
Yeah.
How they ought to talk about porn? Is that it?
yeah, yeah, absolutely. Like, if you have any tips around that, like, how can people navigate talking about this
Mhm.
and managing these differing, like, if they have differing viewpoints even, that they're
Mm-hmm.
coming to the relationship with, how do they get on the same page?
Mhm.
Mm-hmm. Well, I think it's helpful to talk about people's origin story when it comes
Mm,
to porn, right? What are their attitudes
yeah,
about it? What did they learn about it? Why do they have the beliefs that they do? I think that can lead to some understanding, hopefully.
yeah,
And then, I think that when it comes down to it, it's also like setting agreements or boundaries of your relationship or both, right?
yeah,
Mhm.
So it's like some people find that they want their sexual relationship to be very monogamous to the point where it's just between them and their partner or partners, and that,
Yeah.
you know, that would include porn. For other people, that's something
Mhm.
that feels like it's very comfortable for it
Mhm.
to be a solo sex experience. So I think, you know, being
Yeah.
able to talk about these kinds of things and what you consider like an within your relationship agreement versus without. And again, I'm kind of
Yeah.
centering monogamy here. I think that this is something that transcends all
Yeah.
relationship structures.
Mhm.
Yeah. For
So
sure.
yeah, that's something I would invite forward. Like the earlier the better to be talking about this. And then two, recognizing that, you know, like understanding the role it has for you, because I think a lot of
Mhm.
people
Mhm.
think that it's something that like people put a lot of stock into. And I
Mhm.
think for
Yeah.
a lot of people, they use it as entertainment or release, like we do Netflix and chilling in a way. So yeah, I think understanding the role that it can have is important.
Yeah.
Thank you for courageously, I mean, it's probably easy for you, but answering that question, you know, it was probably took a little bit of courage for me to ask, but I know I'm asking for many people who are listening that are like,
Mhm.
Yeah.
what do you think about this?
Mhm.
Because I
Yeah.
think there's so much shame and stigma
Yeah.
associated with sex in general.
Yes.
So
Mhm.
any aspect of
Mhm.
sex that's a little bit more taboo gets pushed to the margins.
Right.
Yes.
So, like, you know, just being a therapist, I've existed in a world for a long time. I know for you as a sex therapist, it's like the
Mhm.
line for what kink is probably is a little further back for me. That line is further out for me than most people.
Yeah.
And
Yeah.
but I realized that, you know, after working with a lot of people, that there are many things that are considered kink that I would be like, oh, that's just like every day, you know? And it's interesting to be in a society that's
Yeah.
evolving. People are talking about more of these things openly, but there's
Mhm.
still a lot of shame,
Mhm.
stigma associated with talking openly about
Mhm.
sex in general.
Mhm.
You make it comfortable because you're a
Mhm.
therapist, but
Yeah.
how do we get to talking about sex with our partners, with
Mhm.
our friends in community in a way that's comfortable? It's of course like, you know, boundaried, but like, how do we get rid of
Mhm.
this stigma and this shame?
Mhm.
Yeah. Well, I think the first thing we do is we start bringing it up, just like you did, Mel, right? I know it took the courage for you to ask me this question, right? A lot of people are probably wondering about porn. I could probably talk about it for, you know, 10 more hours, to be honest. I have a lot
Yeah.
to say, but, you know, I think it's the first thing we do is we just start talking about it, right? Like the
Okay.
things that we approach instead of avoid has a huge impact on like how we feel about it, right? So many
Yeah.
people feel a sense of sexual shame because something
Mm.
wasn't talked about, and we don't
Yeah.
give voice to something, then we
Mhm.
know you're silencing it, right? Or it's
Yep.
something that
Mhm.
Yep.
is considered shameful. So I think
Yeah.
the first thing you do is start talking about it, right? If you're on a date and you're like, oh, so how do you feel about sex? Like, right? Or like, I mean, you could just ask that. Or like,
Yeah.
is like sex really important to you in a relationship? Like
Yeah.
these
Mhm.
can be questions that we just start talking about. If you're in a longer term relationship, I think like, hey, can we chat about our sexual relationship? I think it's a good thing that we could do a check-in, which I'll come back to later when we talk about tools. I have a feeling you're going to ask some questions about that.
I love that. I love that. Yeah, that's
Yeah.
definitely something that we've like done for a long time. I'll say from
Mhm.
the beginning. Just
Mhm.
very
Mhm.
naturally leaned into like check-ins before, after, during
Mhm.
sex. That's
Mhm.
just like a
Mhm.
natural thing.
Mhm.
Um, and I don't, maybe that's the therapist inside of me. Maybe that's just like a thing.
Probably because I was not open in the
Mhm.
beginning. I was like, "Why we have to talk so much? Why is this necessary?"
Mhm.
But I've grown to really appreciate the value of it. Like I was saying, like being able to fantasize and think about exploring and just really have check-ins like you're mentioning about what went well, what we might be able to do different the
Mhm.
next time, I think has been super helpful, but it was not my leaning in the beginning.
Really?
No.
So, like in our early
Mhm.
20s, and we're trying all this new stuff. Mind you, everybody that listens to this podcast, I hope you all know I am transgender. I
Mhm.
was super femme when I met
Mhm.
Tiffany. I was
Mhm.
assigned female at birth, and
Mhm.
I went through gender transition through our relationship. Jen
Mhm.
knows because Jen was there. Jen remembers mini skirts and stuff like that. And so, you know, so we were exploring all these things that were new to us at the
Mhm.
time.
Mhm.
Mhm.
uh you still were not open to really talking about it.
Right, I was open to doing them and exploring them, but I was like, "What's the point in communicating about it?"
That's crazy.
Yeah.
Well,
Yeah.
not crazy. It's I'm that's an expression I mean to say. That's wild. That,
Yeah.
very good to learn
Mhm.
about you.
Mhm.
Very how many people would you say are open to doing stuff but not talk about it? I imagine that's a lot of people.
Yeah, a lot.
I mean, I think what Tiff you're saying, it's like it's very common, right? A lot of people, if
Mm,
we're taught, and I don't know your history on this, so I don't want to assume, but I think like if we're taught not to talk about something, we typically don't bring it up, right? Whether it be
Mhm.
sex,
yeah,
money, religious background, politics, whatever. If we're taught like we don't go there, then we typically don't.
you're right.
And then so it can be like really jarring or uncomfortable
Mhm.
or like surprising, right? When somebody's bringing this to the surface, someone you're in a
Mhm.
relationship with. So I could totally get how that would translate for you. And like knowing Mo, who you are, I'm like, of course you're going to talk about this because you're going to talk about
Exactly.
everything.
Everything, right?
Talk about everything.
Yeah.
Yeah. Oh my
Yeah.
god, I love that. I wanna shift a little bit, Jen,
Yeah.
because when thinking
Mhm.
about myself or even thinking about friends or people that I talk to in relationships, long term or not, what often comes up when we do have the conversation around sex, which is not often, I'm like, "Why y'all not trying to talk about sex?" I've been elevated, now I'm open to talking about it, and I'm walking around like, "Why y'all not talking about it?" But what often comes up is people in relationship talking about sex discrepancy. So,
Or like desire
Mhm.
I'm
discrepancy.
sorry, not sex discrepancy,
Mhm.
desire
Desire
discrepancy.
mismatch. Yeah, totally get it.
Yeah.
Yes.
Yeah.
So oftentimes there's one person that's like, I just want it, I want it, I want it, I want it, I want it. And there seems to be another person or more than, dyad or beyond, other people that are like, not so much. There's like this real difference. And it poses a lot of challenge for people sometimes. Lots of frustration. I think I
Mhm.
often am sitting with friends in the like, oh my God, I need more sex, or oh my God, they won't get off of me. Kind of thing. And so
Mhm.
I'm wondering, as a person, one that experiences my own level of challenge in sex in my own personal
I got
life,
thoughts about that.
but also as a person with friends who are,
Mhm.
often describing this situation, could you talk more about desire discrepancy? And for anybody listening that might not know what that is and
Mhm.
what that
Mhm.
can look like in relationship?
Yeah.
hmm Yeah, for sure. So in its basic form, it means that there is a discrepancy or a difference between how often somebody has an interest in sex. I like
Mm,
to equate it to something that's far less stigmatized, such as ice cream, right? Somebody wants ice cream once a week. Somebody else wants ice cream twice a week, right? There is a discrepancy in
mm,
how often they want ice cream. Now, with ice
mhm,
cream, there's usually not a big, I mean, I don't know, I guess some people may experience this, but there's not usually a lot of conflict. This is not
Right.
usually a very loaded experience for people. They can
mhm,
go to the ice cream store or go to, their grocery store, get a tub of ice cream and satisfy the need. And it's not a big polarizing experience. However,
mhm,
when it comes to sex, because it's often, there's so much focus on partner sex, like the other person has to kind of be involved in that. Whereas with ice
mhm,
cream, there's less of the like loadedness around it. And I find
mhm,
that for a lot of people
Yeah.
who experience conflict related to this, it is loaded and it's something that, is really impacting like their connection in the relationship too.
mm,
So that's why it's a challenge. But in a nutshell, it's basically, a difference in terms of the frequency of how much people have that interest or desire for sex, which is incredibly
Yeah.
common and true in pretty much every relationship.
mm,
The main thing to remember is that some people's difference or discrepancy is greater than others, right? So some people, might
Yeah.
be in a partnered relationship. One partner wants sex once a week and one person wants it once a year. That's a much bigger discrepancy than the once a
mm,
week, every other
mm,
week or something like that.
Yeah.
And it's not
mm.
always the size of the discrepancy that's so much the problem, but
Yeah.
it's again, that the stress around it, how they handle it, potential conflict
Yeah.
they can get into related to it.
Yeah.
Mm.
Thank you for saying that out loud. I could go
Yes.
in deep into a lot of stories about this. What I've learned over the
Yeah.
course of like our relationship has been
Mhm.
for me. for one, transition, testosterone is a whole drug. Okay, that
Yeah.
like
Hormones
in
are, you don't mess with hormones. Those are intense. Like,
oh my
Mhm.
gosh, right? So testosterone certainly
yeah,
does make your like sex drive like it's you're going.
Yeah.
intense. Yeah.
And intense now because I'm like into my 30s. It's dialed back a little bit than I
Mhm.
imagine if I was in my 20s. But what it did, I had to become aware. So I'll say for anybody who has like a higher sex drive than their partner or has more desire for sex than their partner, then I would
Mm-hmm.
say becoming aware of what the need
Mm.
is like really important
Mm-hmm.
because it might not be that you feel like you have to have sex with your partner all of the time.
Mhm.
Could be like you need some
Mm-hmm.
alone time
Mm-hmm.
to have sex and you don't have enough time by yourself to do that.
Mm.
You might need, for me, it was that I was realizing that I had equated uh connecting to Tiffany through touch or through sex as like a show of affection. So
Mm.
what was happening, and
Mm.
there were these breakdown moments in our communication. What was happening was that when I would motion like make some type of gesture, it was probably a like a verbal gesture, like I really would
Made
love
a
to be with
pass.
Mm-hmm.
you,
Mhm.
you know.
Sure.
um when I would do that, she would like flick me away in a very aggressive, like
Mm-hmm.
sometimes it bordered on, no, get away from me,
Mhm. Mhm.
And so
Mm-hmm.
for her,
Yeah.
so it got to a point where I was like, it's really not about having sex with you. I think I'd be fine here just holding you.
Mhm.
What I
Mm-hmm.
would love though is if you treated my gesture like if I was handing you a bouquet of flowers. Like it's me trying to show you I'm attracted
Mm.
to you. And so when you respond like no, get away, I feel very I feel very disappointed, very hurt by that.
Yeah.
I'd
Yeah.
feel like okay with your saying I'm not really feeling it, but I really love that you're attracted to me and I see that you really want to be with me. Let's, try again for a different day or
Mhm.
whatever. And that has really
Mm-hmm.
revolutionized our relationship. It really changed
It
how we were
Mm-hmm.
has.
approaching
It
these
has.
differences. I feel seen in that. And I
Mhm.
realized it's not really about it wasn't really for me about having to have sex. It was
Mhm.
like I had spent all of this time and my relationship to sex was centered around like connection. So I
Mhm.
was like, I really would like to
Mm-hmm.
connect with you. I want you to
Mhm.
know that I'm attracted to you. This is one of the ways I can show
Mm-hmm.
you I am so attracted to you.
Yeah.
And I had to learn other ways.
Mhm.
One, I had to learn some new tricks. And
Mhm.
then two, I
Mm-hmm.
had to communicate to her that how she receives that really
Exactly.
matters to me.
Mhm. Mhm.
Yeah. Yeah. I'm
You
so
had
glad
something.
y'all did that because yeah, Tiff, I want to hear from you too because I feel like this is important.
Yeah, so I certainly was thwarting. I'll use the word thwarting.
Yeah.
Thwarting off his
Mm-hmm.
passes and his different invitations into sex or just intimacy in general. I think in my head though, I was very much like I don't really want to engage in sex right now. Like,
Yeah.
and so
Mm-hmm.
because that was where my focus was, then it shut out everything else. So that shut out an
Mm-hmm.
opportunity to cuddle, an opportunity to make out, an opportunity to kiss, any of these
Mm-hmm.
things. And so once we sat down and had that conversation, I really was like, okay, I can see how this can come off as like I'm just rejecting you constantly. And it's not that is that I need to be vulnerable, like we talked about in the beginning, to say, hey,
Mm-hmm.
I'm not really feeling this thing right now, but I'd love to do this. And that takes another level
Mm-hmm.
of vulnerability to be able to say, I don't want this, but I would still very much like to be close to you. I would like to cuddle with you,
Mm-hmm.
like any of these other things. And so it's certainly been a game changer in our relationship. And it has only been able to be successful with the level of vulnerability.
Mhm. Yeah.
Yeah. Well, what a
Mhm.
moment for your relationship. I'm just so proud and like giving you props over here. Because not only did it take vulnerability, Tiff, but it also took you communicating about sex, which it sounds like was
I
not
know,
your
right?
default pattern, right? So,
Yeah.
and though for you to name what you needed, right? Because I think what often happens is in the sex therapy world, we call these gestures bids. almost like a bid for
Mm,
attention, not in a like
yeah,
kind of self-entitled kind of way, but more in
yeah,
a bid for connection or bid for attention from your partner can be something that's
yeah,
important to nourish the relationship. And it's like
yeah,
a
Mm.
lot of times people do feel like there's a misunderstanding of of why, like what's behind that bid. Particularly with sex, a lot of people are like thinking, oh, like I don't have the time or the energy for this right now.
yeah,
And so they do kind of push partners away, or they don't even ask their partner, right? So there's partners that end up turning away from each other and then they're very distant. And that is
Mhm.
part of the work of what happens in sex therapy often is like, how do we
Mm.
reconnect? But I think it's so beautiful what you were describing in terms of how you both, um, you know, kind of, you worked around this because, it's a challenge that so
Yeah.
many people experience.
yeah. Thank you so much for affirming us.
Yeah. It's
When,
been a journey.
Yeah.
yeah.
It really has, and this has
Yeah.
been a very helpful tool. Imma
Hmm.
let you go.
Oh, when we realized that was going on and we course
Mhm.
corrected, I, I appreciate the affirmation because as I'm like receiving it from you, I realized like, yes, that was such a pivotal moment in our journey. And I can say
Mhm.
things have not
Mhm.
been the same since. They've been
Mhm.
better.
Mhm.
Mhm.
I would say that
Yeah.
that was, what do you say, like a few years ago. We've been together a long
Mhm.
time now.
Mhm.
That came about because our desire has shifted after we had children. Like we had a
Oh
daughter,
my
it
gosh.
shifted with life
Yes.
changes.
Yes.
Because
Right.
before Tiffany's desire was probably greater than mine. It's like
Baby.
we we've like shifted. And so me being in the seat of like the desire shift, like in wanting more
Mhm.
sex, well, really more connection,
Mhm.
that's required that I had to show up and be vulnerable enough to say, when I am like gesturing towards sex, really what I'm trying to say is I'm really attracted to you. I want to be close to you. I want to be in your skin. I love your
Mhm.
And he
body.
said it just like that, Jen. It was like he was prepping himself to say something to me that was just so important to him. And it was like, when you do this thing, it feels like this. And he was able to be vulnerable, and that softened my heart. Honestly, it allowed me to really be open and listen, like, oh wow, like I never want you to feel like that as a result of me doing these things. So what do we do to work on this? And so like he's
Mhm.
saying, his level of vulnerability allowed for me to be able to really, really like sit with the impact of that.
Yeah.
Mhm.
So I appreciate the
Yeah, for
affirmation.
sure.
Yeah.
Yeah,
Yeah.
and in couples, the relationship therapy, we generally call this like a soft startup too, right? Like you lean
Mm.
in with like the softer emotions and kind of what's going on for
Mm,
you, as opposed to
yeah.
that more like critical feedback of like, well, you're not doing
Mm.
this, right? Which is
Yeah.
not so easy to approach, and like how differently that can
Mm,
feel when somebody,
mhm.
you know, presents it differently. So I think that I'm just kind of like
Yeah.
naming this for those who are listening and not in the couples
Mhm.
therapy world and
Yeah.
they're considering it.
Mhm.
Yeah.
And Mo, you brought up
Good,
something
good for
really
y'all.
important.
Thank
Thank
you.
you. Mo mentioned how my desire kind of shifted as I
Mm,
became
Mhm.
a mom. And I know for a lot of people, becoming parents can be a huge shift in your dynamic, right? For obvious reasons.
yeah.
In the very
Mhm.
beginning, you're probably not getting sleep. The baby could be in your room, so many different things. But there are also
On your
some
body.
on your body.
Literally.
Additionally, there are
Mhm.
just so many other life transitions that you go through when you're in a long-term partnership, or not.
Mhm.
I think about for me, like when I'm experiencing grief or when I'm experiencing a very difficult
Mhm.
emotion, it is extremely hard for me to lean in
Mhm.
physically to want to have sex. And
Yeah.
so I can
Mhm.
imagine as we get older and we experience more loss, we experience loss of family members, we experience loss of very close
Mhm.
friends, we have babies, all of the number of transitions that happen. How do we how do we ensure that our sexual and intimate relationship remains a priority with all of those transitions? Or how do
Mhm.
we allow ourselves grace, I think, is what I'm really asking here. Because I think for me, even as I noticed that my desire was shifting, I was very hard on myself. I was
Mm.
very like, okay,
Yeah.
this is not how things used to be. And it
Mhm.
was extremely difficult. So I'm wondering if you can speak to people on um how they can allow themselves grace through all of those transitions.
Yeah.
Yeah, absolutely. And there's so many things that are kind of, I'm thinking about as you're talking about like having grace for one another, because when we think about sex and what is, really important for a positive or quality experience, it's being really present. And a
Yeah.
lot of the things that you're talking about, grief, having a kid on top of you, the stressors, the life transitions people go through, they take us away from being
Mhm.
Yeah.
present with ourselves and with one another.
Yeah.
And it's such a mind body connection, right? People could have sex physically, potentially,
Yeah.
but they might not be, if they're not mentally as engaged, right? They're
Right.
not likely to have as positive a pleasure filled experience. And so
Mhm.
it's
Mm.
important to be able to be present. And when we have all those things happening, it really gets in the way. So I think holding grace for yourself means recognizing first that the amount of experiences you're having doesn't necessarily mean that it's going to be the most impactful thing in your relationship, right? It's
Mhm.
much more important to value the quality of the experience as opposed to the quantity.
Yeah.
Yeah.
And
Yeah.
and also recognizing that there are lots of ways to experience pleasure. And
Mhm.
if
Yeah.
you and or partners can focus on pleasure as the goal as opposed to an orgasm per se, or having
Mm.
sex a certain amount of times a week. I think that that can be a more attainable thing to do.
Mhm.
Yeah.
Mhm.
Oh, that just
Mm.
brings me to how much time we have. We have some time.
That's
We have
good.
a little time.
Yeah.
Uh, You saying you want people to focus on prioritizing pleasure, that is really
Hmm.
important. It's very
Mhm.
profound. I so
Hmm.
much of sex is in culture, the way we talk about it is focused on climax. It's focused on like this end goal.
Hmm.
So when I think about various conversations I've had with women over the years, around their dating, their sexual dating relationships, uh, pleasure for cisgender hetero women is often deprioritized in like
Mhm.
sexual encounters. And even
Hmm.
down to like whether or not people are having oral sex or not having oral sex or like whatever. Even if they want oral sex, they don't feel like they can ask for it or it's
Mhm.
not going to be right with their cisgender hetero partners. Um, there's all
Hmm.
this stuff with women and like in culture around like women getting to receive pleasure. I don't the question that is forming is not quite just like why is that the case?
Mhm.
I almost want you to tell us why, but I really want you to tell us also like how to do something about it. Like what's your if you were talking to a girlfriend and let's say she was like, I
Hmm.
really wish this person I'm dating would give me head because once we're done having vaginal sex, he's done and I need something more. How do I go
Hmm.
about getting that?
Yeah.
What would you say to a girlfriend?
Hmm.
So like first tell us how this is getting set up where women don't get their pleasure prioritized. But then also what you tell a girlfriend if she said, I need some help in this
Hmm.
area.
Mhm.
Okay. So the first thing is we've got this terrible script for sex for cis hetero folks that is, you know, people have foreplay, then they have penetration, then it ends with like the
Mm,
person with the penis having an orgasm, and then you're done. And that's
yeah.
not very helpful for most cis women. Um,
Mhm.
Yeah.
it's not really helpful for anyone with a vulva because a lot of people don't experience
Mm,
an orgasm or a great deal of pleasure from penetration. And it's also very focused on, again, that goal of orgasm and then sex just is done. Like
yeah.
that, it's just,
Mhm.
it's not very helpful. So I think the first thing we got to do is toss out that lousy script that's not serving so many of us.
Yeah.
And the second thing is to invite in new scripts. I think this is one of the things that I love about, a lot of the research focusing on queer partners finds that this is where a lot of there's a lot more sexual satisfaction, right? Because we already are going off script in our own way. And so we're
Mm.
not sort of focused specifically on that orgasm and that being the end of sex. And so therefore,
Mhm.
a lot of people report having, more pleasure. A lot of bisexual women and queer women experience that more so,
Yeah.
than the cis hetero folks that we're seeing from research. And I
Yeah.
think the how is like you said, you're starting to communicate about it. So we know sexual assertiveness is hugely impactful.
Mhm.
And,
Mhm.
if you can be, forward about that, like what you want with your partner, and you're
Yeah.
starting that from early on, or you're practicing this in an ongoing way and saying, hey, I want you to go down on me, or want a head, or whatever, however you're going to
Mhm.
phrase it.
Mhm.
Like, I think that like you center what feels good to you, right? And like
Yeah.
Yeah.
that's what leads to the next conversation of that potentially happening. And hey, maybe I don't even want to have any kind of penetrative sex, or maybe that's not something that's ever on the table for you, because it's not something that you enjoy. It's like
Yeah.
we talk a lot about sexual menus in sex therapy. So it's like you can create
Mm.
your own menu. If this is your restaurant, like
I
what do
love
you want
that.
to be on the
I love
menu?
it.
And the menu
Mm.
can change because what is on the menu on a Friday might be different than what's on the menu on a Monday.
Yeah.
And
Mhm.
that's okay.
Mm. Mm. I love
Mm.
that.
That's a great
I can
analogy.
see myself being like, "What do you want to eat?"
What's on the menu tonight?
Cannot
What's
resist
on
the
the menu
joke.
tonight?
Exactly. I have this special going on tonight.
Oh my gosh.
Yeah,
We will have
exactly
some fun
though.
with
Like
that.
what's on the menu du jour?
Yes. I love that.
Love it. Thank you.
Mm.
Yeah.
Wow.
Hmm.
So many good gems. I feel like, yeah, when I think about sex and I think about even you, this idea of having this menu, I think is very helpful. And I think ultimately communicating about sex is so helpful. And I
Yeah.
think so many people just don't talk about sex. We don't talk about
Hmm.
sex. We're uncomfortable with sex. We're uncomfortable with pleasure.
Yeah.
For me, I feel like I have been a person that has experienced, some grief, some different pain and things in my life that I was like, I don't want to experience pain anymore. And I'll shut out the pain. But with shutting out that pain, that also shut out these real opportunities for pleasure. And
Mhm.
those things spilled
Hmm.
over into, me as a sexual person. And so these are things that I've become aware of later in life. But I can imagine that being more open in communication or just simply talking about these things can really uncover a lot. And so I just, I'm loving all of the things you're saying, Jen. And I just want to say to anybody listening, I am a person who had no interest in talking about sex in the beginning of our relationship or even in the beginning of my own sexual journey. And it has single handedly been one of the most important
Mm.
tools that have helped me in this journey and I think will continue to
Yeah.
help me evolve.
Yeah.
Mhm.
Yeah.
Wow.
So,
What a beautiful
Jen,
thing, Tiff. Wow.
aw,
Thank
so
you.
beautiful. So, Jen, if you could leave us, I should be calling you Dr. Jen. I should have been
Dr.
saying Dr.
Jen.
Jen this whole time.
That's okay.
If you, we love to hear from you about what we call a love resource. If you have a
Hmm.
tool, a book, a something that has supported you in your career or personally that you'd love to leave our audience with that you think would help them in their sexual relationships.
Mhm.
Hmm. One of the things I alluded to earlier that I really love is the idea of a check-in specifically around
Mhm.
Yeah.
intimacy and sex. So we often take a look at like our bank accounts, right? And check in like, oh, like how much is in there? Like, is everything flowing the way that it should be? We often check the weather to see, what's going on. What kind of jacket do we need today? All that kind of thing. And one of the things that we need to get better at, I think, as a culture and in relationships from what I can see professionally is, just the power of checking in and understanding on a regular basis, like where folks are at, right? Like
Mhm.
Yeah.
how are you feeling about what's going well this week? What is it that you want to be working on? More generally speaking, but also like from an intimacy perspective, like how close are you feeling right now? What are you needing for our
Mhm.
connection? Is there anything that we can, that you want to kind of put our eyes out for, in the
Mhm.
week ahead,
Mhm.
that kind of thing. And I think the same
Yeah.
can be true if you're working on improving your relationship to sex. And it's a great way to like start talking about it and saying like,
Yeah.
okay, what do I want to work on communicating this week? I want to be more intentional
Mhm.
about stating when I feel open to being physically close, right? If
Mhm.
for somebody who maybe
Mhm.
has a hard time naming that, like that would be a big deal. So I think that the power of a regular check-in about sex and intimacy is really, really useful.
Mm.
Beautiful.
Thank you, Jen.
Beautiful.
Thank you for sharing that.
Yeah, I love
You're
it.
Mhm.
welcome.
Check-ins definitely have helped us, and
Mhm.
I encourage check-ins of all kinds. So that particular tool, we'll have to make sure that we put something on our website to lay out that resource for
Mhm.
people.
Mhm.
Um, this is brings us to truth or
I'm
truth.
gonna pull up my question.
So this is where we pretty
Yay.
much ask a truth or dare style question to you, but it's really just gonna be truth questions. And
Okay.
so it's at least one today. I'll
Mhm.
let Tiff take that away.
Okay, Jen. So this is a would you rather question in the spirit of you being a sex therapist. It's one that we've
Hmm.
asked here on the show before. Would you
Okay.
rather walk in on your parents having sex or have them walk in on you having sex?
Oh gosh. I think both would be pretty uncomfortable.
Yeah.
I think am I the age that I am now, or am I a child? Like,
You get
how
to
old
be
am
the
I when
age
this
you are
Yeah,
happens?
now.
right now.
I think I'd rather them walk in on me. Yeah, I think that makes more
Yeah.
sense because I think they would
Mm,
probably close the door and run the other way, and then
yeah.
it. Yeah, I think that's how I would. I'd rather have it that way.
Yeah.
Oh, wow, that's good. I was like,
Mm.
"No, I'd rather be the invader of privacy."
I feel like if I invaded their privacy though, I wouldn't it would be stuck in my head.
Yeah, I feel
Like, I
that.
don't know that I could not see it.
Yeah.
I
Mhm.
don't know.
Yeah,
I
that's
think
a
it's
really
also
great
far
answer.
less likely for that to happen. So I think I'm like, as I'm thinking about this, I'm like, this probably wouldn't happen. But like, if it
Yeah.
were to, I think I would prefer it this way because I don't think I'd be paying attention to it as much. Whereas
Mhm.
like you said, like if I was the person that was opening the door or like somehow, coming into this, like I think it would probably be like, in my mind for more than I would like it to be.
Yes,
Yeah.
right. Well, thank
That's
you, Jen.
funny. Yeah.
You're
Wow.
welcome.
Mhm.
Now,
It's a good
Jen, we'd
question.
love for our audience to keep up with you.
Mhm.
So, we'd love for you to share with us how our audience can stay connected, any offerings you have right now that you want people to know about, and then your social media and things like that.
Yeah, for sure. So, my practice's website is called embracesexualwellness.com, and we have a ton of resources there. So everything from
Yeah.
books, videos, podcasts. There's a TED Talk with Mo on the website. And, we've got a lot of resources. I'm also online at Embrace Sexual Wellness on Instagram and Facebook. And we post a lot of sex positive content there. We also do educational workshops and speaking
Mhm.
events throughout globally, really. So,
Mhm.
for folks who
Yeah.
are looking for a sexologist to come teach their community group or, come to their university, we have done all kinds of educational workshops. So we are available for that.
Mhm.
And if you're in Illinois, let me see, Indiana, Kansas, Idaho, or Louisiana, we can work with you
Nice.
for therapy.
That's
That's
awesome.
amazing.
Thank you
Yeah.
for sharing that. Yeah, so I have to say, like your entire practice, you all are so queer friendly, queer affirming, celebratory.
Mhm.
So for anybody that's
Mhm.
listening and you're in those territories, you're wondering about finding a very affirming and celebratory therapist,
Mhm.
look at Jen's practice,
Mhm.
and you're going to find like a really great therapist. So I just wanted to say that out loud.
Mhm.
We really appreciate you being
Yes.
here. It's always a pleasure to pick your brain, so to speak, and learn from you. You really have a beautiful expertise. You're also someone who's known for a long time what you want to do. I talked about this with you the couple weeks ago. I was like, how did you know in grad school you want to be a sex therapist? I just remember that so strongly as your voice in grad school. So it's really beautiful to see you shine, to see you doing this work now. And you really you're offering our community a lot, and you offer people so much just by sharing this information so freely, because it's not common knowledge, and you do it with so much grace and compassion. So I'm really grateful for you being here and sharing with us.
Thank you
Oh,
so
thank you
much,
so much for
Jen.
saying that. Oh,
Yes.
I
Yeah.
And thank
love
you, Mo,
being
for
here and
sharing Jen
chatting
with
with
us.
y'all.
Aw.
Oh,
Yay. We love having you here. I'm
Yeah.
always happy to share Jen.
Yeah,
oh.
thank you for sharing, because she's not just yours now.
Aw, beautiful. I love
I'm gonna
it.
have to have a tug of war.
I know, right?
Wow. This has been a really beautiful episode of the Be Your Own Love Goes podcast with Mo Ari.
And Tiffany.
You all have a great day and be well.
Bye. If you're listening to this on Apple Podcasts, don't forget to rate, review, and subscribe. Video episodes are on YouTube and Spotify.
If you want your question included in an upcoming episode, feel free to reach out to us on Instagram at Be Your Own Love Goals, or check out our website at lovegoalspodcast.com. We look forward to hearing from you soon.
Bye.